All right, we are officially into week 12 of class. And remember, week 12 is going to include um, your diet analysis project. That's going to be due at the end of this week. So make sure that you are paying attention to that you have started collecting your data and all of that. And in this week's folder will be where we'll turn that in. So if you have any questions about that this week, let me know. This week, the lecture is going to include two related chapters, chapters 14 and 15 this week, which basically is life cycle nutrition. Chapter 14 goes pregnancy through infancy, and 15 goes through childhood to older adult stage and the differing dietary needs we have during those periods of time. So we're going to start with pre-pregnancy, what everyone, both a male and a female, would need to do in terms of a healthy diet to make conceiving a child easier and healthier, I suppose. So just like females, males' lifestyle and diet choices affect the health of the sperm, just like they affect the rest of the body. So smoking, alcohol, drug use, obesity, those things may decrease sperm production, sperm count, and motility and function and all of that stuff. So healthy lifestyle, good diet, good exercise make for a healthier body and therefore healthier sperm. Having enough zinc and folate are associated with healthy sperm production. Certain antioxidants like vitamins C and E and carotenoids can help protect sperm from the same thing that we use those for with the rest of our cells to protect them against free radical damage or oxidative stresses and all of that kind of stuff. So if someone is thinking about becoming a parent, a male is thinking about becoming a parent, in order to ensure that the sperm are as healthy as they possibly can be. Again, you want to make sure you have a good, healthy diet, a well-balanced diet rich in whole grains, fruits, veggies, and healthy lean proteins in order to give your sperm the best chance you can of being healthy and functional. On the other side, females need to adopt healthy lifestyles before conception as well. You want to maintain a healthy weight, even leading up to pregnancy. You want to get adequate folic acid. Folic acid is important for cellular growth. So it's important for new cells and for the baby's growth and development, particularly the neural tube, which becomes sort of the brain and spinal cord areas. Folate or folic acid is really important for that. And when a mother is deficient in folate or folic acid during pregnancy, you run the risk of developing neural tube defects in the baby's development. Moderate fish and caffeine consumption. Fish is healthy for you typically, but some of our fish have a problem with sort of excess mercury, methyl mercury content, and that is a heavy metal and it is very toxic for us. So if you are, you want to consume healthy amounts of fish, moderate amounts of fish, and caffeine. Too much caffeine in a day can delay conception. So you want to keep it under 200 milligrams per day of caffeine. Greater than 500 milligrams per day delays conception potentially. And then obviously you want to avoid, illicit drugs, toxic substances, cigarettes, things like that. And then just to give you a heads up or just to give you kind of a note on what we mean by moderate caffeine consumption, here is a list of different beverages and their number of ounces that would be found in that particular beverage and how much caffeine in milligrams you have. So you could conceivably have, a 16-ounce cup of coffee and still be fine. You could have a couple of energy drinks and still be fine per day. Espresso has a little bit less caffeine than our like regular brewed drip coffee. So And because with our espresso drinks, we're only drinking small quantities of it here. It's usually 1 shot of espresso is 1 ounce. So a shot of espresso is 40 milligrams of caffeine. You could have, um, you know, 4 or 5 shots of espresso in a day and still be good to go there. Um, some other drinks there. And if you're concerned about your caffeine intake, you can always switch from caffeinated coffee to decaf coffee. It has a very small amount of caffeine, the decaffeinated coffee does, and the decaffeinated espresso is the same thing. So smaller, much smaller amounts of coffee is found, or caffeine, excuse me, is found in the decaf coffee. All right. So once someone has become pregnant, during the first trimester, there is a lot of change going on, a lot of growth and a lot of development. Full-term pregnancy is roughly 40 weeks in length. We divide that into 3 trimesters, like basically 12-week trimesters. And the moment of conception is considered the beginning of the first trimester. And a lot of people don't necessarily know when the actual moment of conception is, but that kind of marks the beginning of the first trimester. And typically, if you don't know, for sure when the moment of conception was, what they'll do is go back to the first date of your last menstrual cycle and then go like 2 weeks forward from there and make that the estimated first day of your trimester. During the first few days, the fertilized egg fertilization usually happens in the uterine tube or the fallopian tube, we sometimes call it. And as it travels down the fallopian tube toward the uterus, a lot of cell division is going to happen. And we're going to get this little kind of solid cluster ball of cells that finally makes its way into the uterus. Hopefully will drop in a place where it can implant into the endometrium or the inner lining of the uterus. And it kind of burrows its way down into the endometrium and starts to develop into an embryo. And after 8 weeks of pregnancy, the embryo then is called a fetus. During that time, obviously the fetus is developing, but also the placenta, which helps to nourish and provide oxygen and waste removal from the fetus, is also developing during that time. During the first trimester, a lot of times a pregnant person will experience morning sickness, quote unquote morning sickness, because it doesn't just happen in the morning, it can happen all day long. But typically we call it like morning sickness. Just a lot of people do have it in the morning, but it's not only in the morning for a lot of people. We don't know necessarily why people get morning sickness, but potentially has to do with like the fluctuation of hormone levels and all of that stuff might lead to some GI upset and nausea and vomiting. You can also have aversions to certain food, like something that you used to like, you kind of can't stand the smell of anymore. Just like food aversion. And then cravings are also pretty common, where you crave a particular, type of food. You crave ice cream or pickles or chips, or you have a craving for a particular type of food. That's fairly common, again, in pregnancy. There is something that's a little bit less common that sometimes happens, and it happens for people who are not pregnant as well, but you can develop pica, which is craving non-nutritive substances. So like you're wanting to eat things that are not food. So like maybe you're craving like cornstarch or dirt or clay or baking soda. It's a non-nutritive substance that you're craving. And that you want to make sure that you speak to your healthcare professional about and get that hopefully under control, because those are things you do not necessarily want to be eating. All right. So as far as weight gain is concerned, the pregnant person is going to gain some weight, and they must do so in order for the baby to grow and to develop. So there must be some weight gain. If you begin your pregnancy at a healthy weight, it's advised typically to gain between 25 and 35 pounds during your entire pregnancy with a single pregnancy. If you're having twins, it's obviously going to be more. Between 37 and 54 pounds would be normal for having twins. In the first trimester, you do not need to be really eating extra calories per se, and you'll typically only gain between 1 and 4.5 pounds in the first trimester. So again, you're just dealing with a small ball of cells basically for most of the first trimester, and you don't need to gain quite as much weight. If you gain too much weight during pregnancy, it makes it hard to lose the weight later on. So it can lead to the parent, the pregnant person being overweight for years to come after pregnancy. It's just more difficult to lose weight when you have gained an excess amount during pregnancy. And then it also, to some degree, statistically increases the risk that the baby might be obese later in life as well. So here's what it looks like as far as weight gain is concerned. For people of different weights prior to pregnancy. So, and based on kind of your BMI. And again, we talked about BMI previously, and we know that it's not super accurate, but it's kind of a general guideline that we go by. So if you're underweight prior to pregnancy, obviously they're going to recommend you gain a little bit more weight. So between 28 and 40 pounds instead of 25 to 35 for normal weight. The recommended gain of weight weekly in the second and third trimester. This is where you're going to gain the bulk of your weight. And for most people, if you're normal, healthy weight or underweight, you want to gain roughly a pound every week in the second to third trimester to ensure that the baby is growing adequately and all of that kind of stuff. If you start out overweight or obese, obviously the weight gain, we want to keep the weight gain a little bit less because you're already starting off with excess weight. So overweight is 15 to 25 pounds, and if you are obese, 11 to 20 pounds is adequate weight gain. As far as where the weight gain goes, where the weight gain comes from, the pregnant person's fat stores do increase because that is important. It's an important part of pregnancy to ensure that you have adequate energy stored away in your body in case you are not eating your meals regularly. So we're gaining about 4 to 11 pounds of fat. The growth in the uterus and the breast tissue is about 4 pounds. You get extra blood, so that's 3 to 4 pounds. You increase your blood supply because you're not just supplying nutrients and oxygen to yourself, you're also supplying them to the growing fetus. The fetus itself at birth would be roughly 7 to 8 pounds on average. So that's 7 to 8 pounds of your weight gain. And then the fluids, the placenta, extra fluids and all of that is another 7 to 8 pounds. So that's our roughly 25 to 35 pounds of total weight gain for someone who is of normal weight leading into pregnancy. All right. So what are the important things in the first trimester? The need for vitamins and minerals and nutrients and all of that stuff increases kind of immediately upon conception. So not only are you supplying those nutrients and vitamins and minerals to yourself, you have to also supply them for the fetus. So we have to kind of increase the nutrient stuff. For pregnancy, it's always recommended that the pregnant person take prenatal vitamins. It just adds the extra folate and the extra iron and things that you need for to maintain a healthy pregnancy and to lower the risk of developing any sort of birth defects in the fetus that's growing inside of you. So and they also recommend that you, if you're thinking about becoming pregnant or actively trying to become pregnant, that you just start taking prenatal vitamins already to prepare for a potential pregnancy. A lot of the prenatal vitamins you have to get like with a prescription. Some of them you can get over the counter, but a lot of them require a prescription. So if you're attempting to become pregnant, you may talk to your physician about getting on some prenatal vitamins prior to conception. All right, other nutrients of concern, especially for vegetarians usually do still eat animal products like milk and eggs and things like that. But vegans who are not consuming any animal products, there are certain things that you typically get through animal products like omega-3 fatty acids in seafood, important for brain and retina development in your fetus, choline for healthy cell division. Vitamin B12, again, is only found in animal products unless you get it in other foods that are fortified with vitamin B12, which is totally possible. A lot of grains and cereals and things like that are fortified with vitamin B12. So you want to make sure that you don't get too much preformed vitamin A. Beta carotene is fine in any quantity, but if you get too much preformed vitamin A, which again just comes from animal products, it increases your risk for birth defects. So you want to limit, if you're getting a supplement with vitamin A, you want to limit that to less than 3,000 international units per day. All right. Here's looking at, the calorie level of kind of the different foods that you want to get there, and sort of percentages of your daily caloric intake there. Excuse me. Pregnancy can increase your risk for foodborne illnesses. There is Listeria monocytogenes is a bacterial infection that can cause miscarriage that you can get from undercooked meat and stuff like that, unpasteurized milk and juices and cheeses and Brussels sprouts, or not Brussels sprouts, sorry, but like bean sprouts and things like that you might put on like a sub sandwich or something. You want to be careful about consuming those things during pregnancy because Listeria can lead to miscarriage, premature labor, low birth weight, developmental issues, and infant death. So you got to be pretty careful with that. And then avoiding things like alcohol, nicotine, illicit drugs, and then restrict your caffeine intake as well to less than 300 milligrams per day. During development, there are most of them are happening within the first trimester because everything's developing really, really rapidly, and there's a lot of tissue and cellular growth during that time. These are called critical periods for development of different organs and organ systems. And it's basically the entire first trimester. It's where you really need to be super careful that the risk of miscarriage is greatest in the first trimester. And during these really rapid periods of growth and development, the fetus is more vulnerable to nutritional deficiencies, to toxins, to other harmful factors. So this sort of looking at those critical periods. And again, we're looking basically just at most of them occur basically within the first trimester, the first 8 to 12 weeks or so of pregnancy. It's these red periods, these red lines in this graph here. So the central nervous system, the heart, the upper limbs, the eyes, the lower limbs, the teeth, the palate, the external genitalia, the ears. These are the really critical periods where we're very susceptible to, if something goes wrong and we're deficient in something, or we come across a particular toxin, it can lead to defects in these different things. So yeah, those are kind of our critical periods of growth, which is basically why during pregnancy, we want to make sure that we are very strict in our diets and careful with our exposures to other toxins and other chemicals. All right, as far as adequate caloric intake, during the first trimester, a pregnant person does not need to consume really any excess calories, just making sure that they get enough of the important stuff. In the second trimester, you should get about 340 calories per day more than you did prior to pregnancy. So you just want to up your intake a little bit more. And it's not a lot. It's only 340 calories per day, which would lead you to be gaining about a pound per week with that. You need more carbohydrates again for energy, and you need extra protein to help build the new baby, basically. So this is what an extra 340 calories would look like in a day. One English muffin with peanut butter, 2 tablespoons of peanut butter, and 5 baby carrots. So when we talk about like, oh, I'm eating for two and you're, consuming a lot of excess calories during pregnancy, those excess calories aren't necessary. And then, like I said, in the second trimester, you just need a little bit of extra nutrient, a little extra protein, a little extra carbohydrate to help get that baby developing. You can, it is safe and important to continue to exercise during pregnancy. So you should be getting at least 150 minutes of moderate intensity aerobic activity per week. And you don't want to do that all in one day, obviously, so spread it out over the entire week. It helps keep your weight gain down. It decreases your aches and pains, lessens constipation, improves your energy, reduces your stress, improves your sleep, and lowers risk of gestational diabetes. So it's important, again, to continue healthy behaviors during pregnancy, like exercise and healthy diet. Now it says safe versus unsafe. You probably want to avoid a lot of high risk contact sports, but and it also kind of depends a little bit on your activity prior to pregnancy. If you are, doing like kickboxing or something like that, you can probably not continue kickboxing, but you can maybe like kick the bags and use the bags and stuff to continue that particular activity. um you know you want to avoid basically like heavy contact stuff that's high risk of you sustaining an injury that could also cause damage to the developing fetus. So if you swim, if you run, if you cycle, you can do all of that stuff. The further along you get in pregnancy, the worse your balance gets a little bit because it pulls your center of gravity forward. So it's probably safer toward the end of pregnancy to do stationary cycling rather than getting on a two-wheel bike and riding around with poor balance. But yeah, you can do pretty much anything you did prior to pregnancy. Just try to keep it a little lower impact. All right. Potential complications, um, gestational diabetes and high blood pressure. With gestational diabetes, that can occur in some people during pregnancy. Um, Things that would increase your risk of gestational diabetes are, excess caloric intake, being overweight or obese prior to pregnancy, gaining too much weight. Those things are all going to increase your risk of gestational diabetes. And what that means is basically that you don't have diabetes normally, but when you're pregnant, you have problems controlling your blood sugar levels, essentially. If you have gestational diabetes, it can lead to having a baby that's too big. It's called macrosomia, where the baby weighs more than 8 pounds, 13 ounces. And you think the larger the baby, the better it is, but actually like really large babies are higher risk of having complications and potential, death, infant death, and all of that kind of stuff. So you got to be kind of careful with that. And then it increases the risk of the baby having jaundice, breathing difficulties, and birth defects. All right, then our hypertension, gestational hypertension, which is where you have higher blood pressure that might develop about halfway through pregnancy. If that blood pressure continues to be high throughout pregnancy and we start to see protein in the urine, that's a sign of kidney damage. And that's what we call preeclampsia. It's where we have the hypertension and protein in the urine, which means your kidneys are being affected by the high blood pressure. Oftentimes the treatments will include like bed rest, where you won't be able to really like get up and do much during the day. Different medications. You want to kind of keep the person as still and calm and quiet as possible until you reach a point in pregnancy where the baby could be safely delivered. If it goes untreated, it can lead to eclampsia, which is where the mother starts to have seizures, and it's a huge cause of maternal mortality during pregnancy. So uh, it just, I guess, highlights or emphasizes the importance of prenatal care during pregnancy so that your doctors are monitoring all of these important health parameters and things like that to keep you and baby as healthy and safe as possible. Moving into the third trimester, we go with a little bit more rapid weight gain. The fetus itself is probably gaining roughly a pound a week during this period of development. So you go from an extra 340 calories per day to an extra 450 calories per day. And again, still trying to gain about a pound a week. It's a little harder in the third trimester because the growing fetus is putting pressure on the stomach and the intestines. As the fetus grows, the uterus kind of bulges up into the abdominal cavity and puts a pressure on all of the digestive organs. So it makes it a little bit harder. You end up with having, you can't eat large quantities of food at any given time. You end up with more like heartburn and constipation. So instead of, trying to eat 3 large meals a day with no snacks, you might want to, at this point, switch to smaller, more frequent meals to help avoid the heartburn and help just make the indigestion and stuff that can occur during pregnancy a little less intense, and maybe avoid acidic or spicy foods if you do have a lot of difficulty with heartburn. And then focusing on your fiber intake, because fiber-rich foods and plenty of water will help prevent constipation. And with constipation comes the risk of developing hemorrhoids. So if you're more constipated, you strain more to have a bowel movement. That can cause backup of blood flow in the rectal veins, the veins around your anus and your rectum, and they can become kind of full and dilated, full of blood and dilated, and then they hang out your bottom and they become a nuisance. They bleed, they itch, they're painful. So yeah, focusing on fiber and water intake especially during the third trimester, will hopefully help you prevent hemorrhoid development. All right, post-pregnancy, we want to talk about breastfeeding. It is, breast is best is kind of one of those kind of phrases that you hear a lot post-pregnancy. Breast milk is designed as the perfect food for human offspring. So talk a little bit more about that. Lactation is the production of breast milk after childbirth, and there's 2 big hormones that are involved in that. Prolactin from the anterior pituitary gland, and that causes milk to be produced in the glandular tissue in the breast. And then oxytocin from the posterior pituitary causes milk letdown or the milk ejection response. So again, prolactin produces the milk, oxytocin causes it to be released from the nipple so the baby can get it. Breastfeeding provides health benefits a lot for the fetus, for the baby, I guess now at this point. But it also provides emotional, physical, and financial benefits for the breastfeeding parent. It helps with recovery from pregnancy, reduces the risk of some chronic diseases. Breast cancer risk is reduced, I think, if a little bit, certain types of breast cancer, if you have breastfed infants prior, at some point in your life. Breast milk is less expensive. You don't have to go out and buy it. And it's obviously more convenient. You don't have to make it. It's a ready supply for those infants. Infant formula can cost approximately $2,000 per year. And the cost of breastfeeding is just a little bit of extra nutrients, a little bit of extra water, plus like some supplies there. So roughly $300 per year. And the emotional bonding with the baby is an important part of the breastfeeding process. Oxytocin is also that kind of love hormone that makes you feel connected to another human being. So that oxytocin uptick in your body during breastfeeding helps you bond with your infant, because babies are hard to take care of. And if we didn't love them, we probably wouldn't put in all that effort to take care of them. So there we are. Again, it's nutritionally beneficial for babies. Um, its composition changes throughout the length of breastfeeding. The initial milk that's produced is called colostrum. It contains a lot of antibodies, protein, minerals, vitamin A, and then as the true mature milk comes in, it's higher in lactose, which is the sugar. It's higher in fat, B vitamins. It's lower in protein. That makes it easier for the baby to digest, because it's a little bit lower in protein there. All right. So with the antibodies and all of that good stuff comes protection against infections, allergies, chronic diseases, enhances brain development, decreases risk of lots of stuff like diarrhea, meningitis, respiratory and ear infections, urinary tract infections, all of that good stuff. It is protective against infections of all kinds. There's some information that says it reduces risk of childhood obesity, and it helps with intellectual brain development, especially our essential fatty acids, DHA and AA, arachidonic acid, aid in nervous system and brain development. All right. In the first 6 months of breastfeeding, the breastfeeding parent is going to produce roughly 24 ounces of breast milk per day, or should. The second 6 months, the supply drops a little bit to about 16 ounces per day. The breastfeeding person needs at least 13 cups of fluid per day. So again, extra fluid requirements, making sure that if you are breastfeeding, you are focusing on that. And then a little bit of extra caloric intake need. In the first 6 months, you need roughly 500 extra calories per day. However, that doesn't mean that you should eat all of that. You should let some of that come from the fat stores that you built up during pregnancy. So about 170 calories from fat, and then get the extra 330 from food. And then in the second 6 months, again, roughly 400 calories per day. Some of that can still come from the fat stores and a little bit extra food. But again, focusing on fluid intake is really important here. The diet should be similar to the diet during pregnancy, well balanced, high in, good nutrients and vitamins and minerals and whole foods and fruits and veggies and things like that. And then obviously no alcohol during breastfeeding, no illicit drugs, and then follow the FDA's guidelines on fish consumption, again, just due to the risk of mercury toxicity there. Now, we're saying breast is best, right? Breastfeeding a baby is best, at least for, you want to do it as long as you can. But the first 12 months of life, at least the first 6 months of life, they recommend breastfeeding basically exclusively. But that's not possible for everyone. Some women can't produce breast milk as well. Some are just, not able to work that into their schedules to be able to pump and do all of that stuff. People work at jobs where they're not allowed to take, a lot of breaks, or they're just not able to do it. So for whatever the reason, some people are not able to breastfeed. Sometimes it's something to do with their own health. They have HIV or AIDS. They have leukemia or tuberculosis, or they're getting chemotherapy for cancer or whatever. Those people shouldn't breastfeed. And there are some babies that have a condition called galactosemia, where they can't metabolize lactose. Lactose, again, is the main sugar source in breast milk, and that means that, they would not be able to metabolize the sugar in the breast milk to get the energy they need to survive. So those kids, again, shouldn't be breastfed. And if you're taking any prescription medications, you want to check with your doctor to make sure that none of those medications are crossing through into the breast milk and getting into the baby, or whether it's safe for you to take those medications during breastfeeding. And then you can make that decision for yourself, whether it's more important for you to breastfeed or more important for you to take the medication that you should be taking. So if you are not able to breastfeed, the next best thing is to use infant formula. Cow's milk does not meet the nutritional needs. It's too much potassium, too much sodium. It doesn't have enough linoleic acid, which is one of our essential fatty acids. It's the iron in cow's milk is poorly absorbed. So the infant formula is as similar as possible to breast milk, and it's regulated by the FDA to make sure that it is as nutritionally appropriate and as close to breast milk as it can be. Babies need a lot of nutrients for their size. They're growing very rapidly. In fact, a baby should double its birth weight by 6 months, and it should triple its birth weight by 12 months. So we want to make sure that these babies are getting adequate nutrition. If they don't, they may have difficulty reaching their developmental milestones, and they might be diagnosed with failure to thrive, which is a delay in physical growth or size, does not gain enough weight during the first 6 to 12 months of life there. So how we track that is using the growth charts, which I don't know if I have in here, but here's basically what a baby needs during its first year of life. 0 to 4 months, breast milk, usually between once the baby is able to control its head, hold its head up, and it is able to, well, when you put something in its mouth, it does not do the tongue thrust reflex, which is where it sticks its tongue out to, help it latch onto a nipple. Once the tongue thrust reflex is gone and the baby is able to hold its head up, usually about 5 to 6 months of age, we start adding infant cereal or like the Gerber baby food type stuff into the diet, because they're starting to need more nutrition than the breast milk is supplying, and they're not full for very long after consuming just milk or formula. Then 6 to 9 months, we start to move on to pureed or strained veggies, fruits, meats, beans, plain yogurt. And then once we get some teeth in there, 9 to 12 months or so, we're able to mash up or give them basically the same foods that you would be eating, just kind of mashed up or chopped up. So they can move on to just kind of like normal human food, roughly 9 to 12 months in there. You can start incorporating those things. There's the growth chart. So this is the growth chart, and you want to, we're looking at percentiles here, and you want to stay, at least above the 50th percentile for most of these things, weight and age and all of that kind of stuff. And there's also one for head circumference as well. All right. So infants have higher nutrient needs. 82 calories per kilogram of body weight is appropriate for a 6-month-old. They need more carbs and more protein as they get older. You should never never limit fat or overall calories with an infant. They are growing and they need that stuff. Excuse me. Babies will need vitamin K injections because they don't have the bacteria in their gut, their large intestine, to make that for them. And then a lot of times vitamin D drops are needed because breast milk typically doesn't have enough vitamin D in it to prevent vitamin D deficiency and rickets. At about 6 months of age, we need more iron-rich foods. These stores of iron that the baby had when they were born, they've already gone through all of that iron, and we'll need some more. So adding fortified cereals and like pureed meats and things like that at about 6 months old. Vitamin B12 if the mother's diet is deficient, And then maybe need fluoride if you don't use your like fluoridated tap water to make infant formula. So fluoride drops or fluoride supplement might be needed as well for development of healthy teeth. So again, solid foods can be introduced when the baby's ready for it. Usually nutritionally ready at about 6 months old. And what do we mean by solid food? Anything other than breast milk. And they also need to be physiologically ready. So the kidneys and the GI tract are ready to process solid food later. Early infants, less than 6 months old usually, or 4 to 6 months old, are not quite ready for that. They need to be at least double their birth weight, and they get rid of that tongue thrust reflex, like I said. They have good swallowing skills, and they have good head and neck control and are able to kind of sit up without support. All of that stuff reduces their risk of like choking on food. As far as we have reflexes that help a newborn eat. The rooting reflex, which is where if you rub their cheek, they will turn their face to that side and like nuzzle around looking for the nipple. Suck and swallow reflexes, like you put anything in you put like your finger in their mouth, you put a pacifier in their mouth, they will suck on that. That's a suck and swallow reflex. The tongue thrust, again, is if you put anything in their mouth, they stick their tongue out. And then obviously like a gag reflex would prevent them from, consuming anything that they shouldn't, basically. It says infants should eat when they're hungry, not on a set schedule, but typically for a newborn infant, that's going to be every 2 or 3 hours. They'll wake up, they'll get fussy. They might be like tossing and turning, sucking on their fist, all of that kind of stuff would be things that would tell you that baby is hungry. But again, it's usually every 2 to 3 hours, not, they shouldn't be like forced to eat if they're not hungry, but they should be eating probably and be hungry every 2 to 3 hours or so, especially early on. As far as introducing foods, do it gradually. Start with the pureed stuff that is like strained and pureed and has no lumpy stuff. And then again, 9 to 12 months or so, you can start adding in, more mashed food that is a little bit lumpy or a little bit more textured into their diet. There are certain things that we don't want to give little kids. So we don't want to give them hot dog rounds, like hot dogs cut into circles. If you're going to cut up a hot dog for a kid, make sure that you cut it in half lengthways first and then chop it up into little pieces. It's a choking hazard. Raw carrots, choking hazard. Things that are potential food allergens. You don't want to give any kind of peanut stuff too early, but after 6 months, it should be safe. You should not give any honey to any child under the age of 1 year old or 12 months old, because it can have spores, botulism spores in there that could be fatal for a little kid. It's totally safe after 12 months of age, though. You don't want to give them too much fruit juice because, again, unneeded calories, a lot of extra sugar. Even if it's 100% fruit juice, it still has a lot of sugar in it naturally. An overabundance of breast milk, at least, or infant formula, at least when not combining that with other foods, can decrease interest in other foods and all of that stuff. So you should be, again, once you reach about 4 to 6 months of age, mixing in, your formula, your breast milk, and trying some of those other foods as well. All right, that's the end of chapter 14. We need to jump in for one more lecture video today with chapter 15 to kind of continue our discussion here. So we'll get that started in just one moment.